Good morning, everyone. Dr. Shook here. Hope you're doing well today. Today's video is super important if you're dealing with rheumatoid arthritis or any type of autoimmune condition. But today I'm really going to focus on rheumatoid arthritis. So if you are only taking a conventional medicine approach to your rheumatoid arthritis, if you're not taking and incorporating and blending that conventional approach with a functional immunological approach, you're missing a huge piece of the puzzle. So the conventional medicine approach to rheumatoid arthritis is primarily anti-inflammatories and immune-suppressing drugs to decrease the inflammation and decrease your symptoms. It then incorporates physical therapy, occupational therapy, and once the joint destruction is severe enough, joint replacement. But what is causing those symptoms to occur in the first place? Why do you have arthritis? Why is your immune system attacking the joints? That's where the functional immunological approach comes in, and these should be blended. So the functional immunological approach looks at individualized strategies based on the underlying mechanisms that are promoting the inflammatory immune response. It's looking at drivers of that process. So for example, some factors that can promote, which I've covered many of these factors, if you look back through my previous videos, I cover many of these underlying mechanisms. Not all of them, but many of them. And these are things like insulin resistance that you may think is not associated with inflammatory responses absolutely is associated with promoting inflammatory pathways that can promote autoimmunity. Other things like microbiome dysbiosis or imbalance, which is the floral species in your digestive tract. Now, if those are out of balance, you won't produce postbiotics, things like butyrate and other short-chain fatty acids that are essential for immune system regulation, barrier system integrity. So the lining of your intestinal tract is critical as an immune system barrier. If that barrier system's inflamed or broken down, it drives the inflammatory responses, which absolutely can promote autoimmunity and inflammation of your joints and further the joint destruction. Prostaglandin imbalance. So we've talked about omega-3 fatty acids, omega-6 fatty acids, and how if those are out of balance, then you can have imbalanced prostaglandins, which help to resolve inflammation. So just imagine if those are out of balance, you might not resolve your inflammatory pathways. Impaired chemical clearance. So for example, your biotransformation pathways of the liver are critical. And then the autoimmune process itself has to be acknowledged. Some people have these inflammatory pathways or processes and not even aware what's happening. So there are things like antioxidants, targeted nutraceuticals, regenerative medicine approaches, and then other things like laser therapy and other pathways that you need to consider. Okay, I want to continue on my previous video because this is important enough a topic that I don't want to blow past some of the things that I said. So when you're taking a functional immunological approach in combination with a conventional medicine approach for your rheumatoid arthritis, you need to consider things like your antioxidant status and your antioxidant reserve. Because when you have rheumatoid arthritis or any autoimmune condition, but especially very inflammatory autoimmune conditions like rheumatoid, you need to have robust antioxidant status to help with the oxidative inflammatory processes that are occurring in the body, to help neutralize and minimize those inflammatory, the damage that the inflammation coming from that immune response is causing. You also need to look at targeted nutraceuticals that support the joint repair and also help to improve immune system regulatory function and anti-inflammatory pathways that can directly support the anti-inflammatory pathways that will help to dampen the pathways like the TNF alpha, the interleukin 6, the T helper 17 pathways that I've mentioned in some of my other videos. There are nutraceuticals that can help to directly dampen those pathways. You've got to address the triggers. You've got to support those so that you can remove the stimulus of the immune response and try to dampen that inflammatory process. But you can also use targeted nutraceuticals, and there are many things that you can apply here. So this is also a key consideration that needs to be made and that you need to do in combination with any type of conventional approach, or you're totally missing the point. The point is, what is driving the process? That is the real question that needs to be answered. Because the conventional approaches, primarily, they're fantastic, they're essential, but they are missing an underlying question that needs to be explored because in a lot of cases you can make dramatic improvements by looking at those underlying mechanisms. So regenerative medicine approaches, prolotherapy, platelet-rich plasma therapy, hyaluronic acid injections, stem cell therapy. These are all things that can be, and that I think will be, very important in the near future. And hopefully we'll have things like insurance coverage for these as well. This is something I'll do individual videos on these to help give you more context, but those are important. And then other inflammatory modulating, what I would call outside stressors that you can consider. So for example, cryotherapy. Even if it's just taking like a cold shower, cold plunges can be helpful in some cases. Again, this is not medical advice, but can be helpful. Thermotherapy, like saunas, red light therapy can be amazing to use, just like pads that you can place on the joint, and then cold laser therapy too. So anyway, if you have questions, ask. I have resources through the link in the bio. I'll be happy to help, but I hope this helps you guys. Talk to you tomorrow.